Hey everybody, it's Kimberly, and I'm going to hop on and say hi and share with you something. I belong to several different doctor groups online, and I just had something come through today which spurred something I want to share with you guys. So this is a person who is seeing a patient who is an Alzheimer's patient. She's end stage and she's getting anxious, and they have her on 1 milligram of Xanax, which is an anti-anxiety. And so what I want to talk to you guys about elderly patients, or if you're an elderly person, something for you to think about. It is very, very easy for elderly people to get toxic on their medications. So the liver doesn't process as well as we get older, or a lot of times we have a fatty liver, and then we start adding, other types of medications in, and we can easily get toxic, and people can get confused. They can start having other health problems. So it's not uncommon for that to happen, and medical a lot of times completely misses this. And then the family's left holding the bag going, my gosh, my parent isn't the same person, or my spouse isn't the same person, and I don't know what to do with them, and yet they're toxic. So one thing I would encourage you to do is talk to their doctor if they're on a lot of medication, if you have somebody who's having some problems with their medications. I want to give you an example of when I was a nurse, when I was actually in nursing school. I worked at a nursing home, and one woman on the dementia floor that I worked on, she one day became combative. And she'd normally been a very, very pleasant woman. She was cooperative, but one day she started getting agitated and started acting out and started actually almost trying to punch the nurses. So they're like, hey, she refused her meds. And believe it or not, 3 days later, she became as good as you and I. She was completely alert and oriented. She knew where she was at. She knew who she was, and she wasn't confused anymore. And the hard part about it is that this woman had been on the dementia floor for 10 years. So in essence, she had lost 10 years of her life being on a dementia floor that she never had to be on because she was toxic for medications. So what I want you to encourage you to do is, if you have a family member that's elderly and on a lot of medications, start looking over the medications. Start seeing if maybe could they be getting toxic. Many times people are put on a medication for many, many years, and they don't really go back and reassess whether they still need those medications. An example would be like blood pressure medications. A lot of times they're on one blood pressure medication, and then their blood pressure starts going up, and it doesn't get better, so they stack a second or a third one. So they keep stacking meds, and they don't remove the other ones because they weren't working. They just stack them. So I just want you to be aware of how easy it is to get toxic in medications, and how to be aware of just assess it, whether if you or your family member has a lot of medications, or even just a few medications. Start paying attention to memory, how you're feeling, and think about, maybe could I be toxic on a medication? And then the only person who can take you off of medication is your medical doctor or you. So no natural health professional can take you off of medication unless they actually have a medical degree behind them, like a doctor or a nurse practitioner of somebody of that source. But I just wanted to put this out there as a consideration, because this poor woman, or this doctor who posted today on this elderly patient has severe anxiety, and they just want to keep upping and upping her Xanax. I thought, you know what? She probably doesn't need more Xanax. She probably needs to come off all her medications because she's just toxic. And a lot of times if somebody is end stage anything, or they have a DNR, DNI, there's no longer a reason for them to be on medication. So again, something else for you to consider.